Hello, my name is Rahul Karna, and we would like to thank Gastrointestinal Endoscopy Journal for the opportunity to talk about our article. Our article is titled Interval Cholecystectomy Following Endoscopic Ultrasound Guided Gallbladder Drainage, a Systematic Review and Meta-Analysis. The co-authors of our study include Dr. Suchapa Arayakarnkul, Dr. Jacqueline Blomker, Dr. Amir Sultan Said, Dr. Iman Afraz, Ms. Nicole Theis-Mahon, Dr. Natalie Wilson, Dr. Rahul Karna, and Dr. Mohammad Bilal. I have Dr. Mohammad Bilal and Dr. Suchapa Arayakarnkul to discuss our article today, and we are honored to be here for the interview. Dr. Bilal, what was your motivation for conducting this study, and why is this a crucial topic?
Thank you so much, Rahul, and really congratulations to Suchapa and you, Rahul, and our entire team for this important publication. And we're again grateful to GIE Journal for this opportunity. EUS-guided gallbladder drainage has significantly increased popularity, and last year the FDA approved lumen-opposing metal stents for treatment of acute cholecystitis. But typically, EUS-guided gallbladder drainage is reserved for patients with acute cholecystitis who are not surgical candidates. But as this is getting widespread adoption, we are seeing more and more patients who are who can become surgical candidates and subsequently. Previously, percutaneous gallbladder drainage was the only option for these patients, but now with the advent of EUS-guided gallbladder drainage, a lot of these patients who can subsequently get surgery do end up getting EUS-guided gallbladder drainage. So it's important to understand the feasibility of the surgery in these patients and the technical success of surgery after these patients. There's obviously limited data in this topic, so we figured that performing a comprehensive systematic review and meta-analysis will give further insight onto this important topic and outcomes of patients who do undergo surgery or cholecystectomy after EUS-guided gallbladder drainage.
Thank you so much, Dr. Bilal. Dr. Araya Karnkul, what were the outcomes in this study?
Thank you, Rahul. So overall, we included 15 studies and 707 patients. The pool proportion of successful interval cholecystectomy after EUS gallbladder drainage was 33%, with the majority of the surgery being performed laparoscopically at 76%. 14% was performed with open surgery, and then for the rest of the 14% required conversion from laparoscopic to open. The overall adverse event rates was 13%, with 7.6% being the post-surgical infection. One study reported a 7% rate of aborted surgery. 3 studies reported perioperative fibrosis and adhesion being found in 100% of the cases. And overall, there was no procedure-related mortality.
Thank you so much, Dr. Araya Karnkul, for the answer. Dr. Bilal, what is the future direction and the next steps you think after this study?
Yes, I think that our study does show that internal cholecystectomy is feasible after EUS-guided gallbladder drainage, especially in a select group of patients. Future studies should focus on assessment of adhesions, technical complexity, operative time, whether this was an open cholecystectomy or laparoscopic cholecystectomy or conversion to open cholecystectomy as outcomes. Secondly, I think that it will be interesting to see the outcomes of patients who do not undergo interval cholecystectomy and what is the long-term efficacy data of LAMS in these patients. So while our study does show promise, I would still caution endoscopists to consider local surgical expertise before performing EUS-guided gallbladder drainage in patients who will eventually become surgical candidates. And this should always be a multidisciplinary discussion involving our surgical colleagues before proceeding with these patients. Finally, we're honored and grateful to present our findings to GIE, and thank you again for the opportunity to publish our work.